David, I know you're involved in some research around healthcare cybersecurity. Can you tell me a little bit about what your focus is?
So in our research group, we're very interested in how you can manage the Internet of Medical Things, or in other words, medical devices, or let's broaden that, health devices, shall we say, um, with non-technical staff. If it requires somebody with technical expertise to install it, configure it, manage the security settings and so forth, it's not going to be done well, typically. Maybe for an MRI machine, you can afford to have the technicians do that. But for every insulin pump or every blood pressure cuff or every widget that is being used by a large extended healthcare system, we need better security solutions that can be handled by the everyday clinical staff.
Well, that sounds like it could be tremendously helpful for large institutions whose IT support staffs are stretched thin, but perhaps even for smaller groups and organizations?
One of our big motivations is small organizations that have no technical support staff, or maybe they contract and they visit once a month or something like that. And some of our research in my lab, in fact, is specifically aimed at that sort of challenge. How do you configure a device securely with no technical expertise? We're thinking of the small clinical operations, but we're also thinking of individuals in their homes who, aren't technical, but need to bring home a medical device, maybe recommended by their physician, get it on their Wi-Fi network and get it working with their other devices. That's today really hard, and especially hard to do it securely.
David, this has been great. Any final words of advice for our viewers?
So I guess to the practitioners, the people who are on the ground actually working with these systems and enterprises that need stronger security and privacy measures is to talk to each other and to learn from each other and to work with your partners, both your literal partners and your peers at other institutions, to sort of lay out and understand the best strategies that can help secure your institutions, platforms, and devices, and so forth. The other is to be open to working with researchers. My group, for example, the Trustworthy Health and Wellness group, THAW, is very interested in working with practicing institutions, hospitals, vendors, medical device vendors, et cetera, to understand the problems that they face and then hopefully to help bring solutions, if not today, then tomorrow, that would help address those problems. And so our group, Trustworthy Health and Wellness, thaw.org is our website, and I hope that your readers, viewers, will find that to be one resource they could look at.